Audible. So, participant, Professor Dr. Akhilesh Pathak is an experienced academician with over 20 years of teaching experience in forensic medicine, primarily in a government medical college in Gujarat. From last 6 years, Sir has worked professor and head of forensic medicine at AIMS Bhatinda and also dean academician of the institute. Sir hold a MD in forensic medicine and postgraduate diploma in health and law PGDHL. Sir has guided postgraduate students for the past decade. Sir has evaluated numerous theses and served as a PhD examiner in university across Gujarat, Rajasthan with extensive medical legal expertise. Sir has conducted over 3,500 postmortem and chaired multiple institution inquiries. Sir has been nominated for the Best Professor Award in Forensic Medicine, facilitated by Indian Academy of Forensic Medicine, and also served national and international publication to his credit. Sir is also the author of Practical Record Book of Forensic Medicine and Toxicology. I welcome you, sir, on the behalf of SIFS India. It is our privilege to have.
So thank you all. And
Thank you so
am
much.
I audible?
Yes, sir, you are.
Okay. And let me try to share my screen.
Yes, sir.
Okay. Is it visible?
Yes, sir. It is visible, but sir, yeah, yes, sir.
And moving?
Yes, sir. Properly.
Yeah. Okay. Okay. So I think now we can move on,
Yes,
right?
sir.
Everything
Okay.
is okay.
Now, sir, session is over to you, sir.
Okay. 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 Thank you.
Thank you so
So
much.
first of all, thanks a lot for giving me this opportunity to share my views, and the topic for today's session is forensic analysis of explosive and traumatic injuries. So today we are going to talk about the injuries caused by the explosion as well as the various type of the trauma. So during this presentation, I would like to share my experience and try to share some of the cases which I have come across recently in AIMS Bhatinda as well as in my previous past years of experience. So these are the objectives for this session. We will try to know what are the explosion injuries, how does it occur, and whenever there is any of the explosion, then how it affects on the body or what can be the different types of injuries over the body. Then we will move on to the next session, that is regional injuries, and especially I will talk about the head injury in that. And when we are talking about the head injury, it is a quite complicated area. So we have to understand what are the different types of head injuries, what can be the different types of skull fractures, and with that the different types of the intracranial hemorrhages. And if you will examine these patients who are having the head injuries in emergency, then what are the signs by examining which we can say that yes, this is the case of head injury. So these are the objectives we will try to learn during this session. So I'm starting with this, that first, what is the explosive injury? So here, as we all know, that we have recently heard about the lots of the explosive injuries or incidences regularly occurring in our India due to different type of the blast injuries. Recently, Diwali has gone, so there may be the injuries related to the cracker blast. Then the injuries can be there because of this cylinder blast. So different type of the gas cylinder or any industrial accidents. Sometimes the tanks or gases, they are leaking and it causing the blast in various industries. With that, definitely the terror attack, that is also quite common in the form of bomb blast. So these are the different types of the explosive scenarios, and from where we receive the patients in our hospital with different type of the explosive injuries. So guys, explosive injuries, these are the damages or the injuries which are caused by the intense pressure, force and debris of an explosion, involving the multiple mechanisms such as blast wave effects, shrapnel penetration, body displacement, and thermal or toxic effects. Remember, whenever we are talking about the explosive injury or the blast injuries, then there are always a different type of scenario is there. In all scenario, what is the intensity of that blast is there, what was the substance used in that blast, whether it is a cylinder blast, whether it is a cracker blast, or whether it is a bomb blast. All these things, uh, in all these cases, the injuries present over the body will be of different shape, size, and types even. So it is always important to understand the mechanism of these injuries. What will be the probability you have to see over the body whenever you are examining the patient, either in emergency or in dead cases. So here is the one photograph where you can see that how this injuries are there, and mechanism you can understand by examining by going through this slide. Here you can see there is a one source of the blast, and from this source there are the multiple things are generating due to blast effect. First thing is the shock waves. You can see the shock waves that are going towards this direction. With that, if it is a bomb or nearby some like stones, or due to shattering of the house and all that, the particles which are the flying objects, so like the flying these penetrating, or even the stones and all that, they also move in a particular direction. With this, you can see that there is a large amount of the flame and fire is there, and with that smoke will also be there. And in such of the scenario, whenever these shock waves are there, they uh, involve the people who are in the vicinity of the shock wave. And whenever the shock wave, they will pass on through the body. Sometimes they are so strong that the whole person will be thrown away from that area, and that person will strike either over the ground or to the nearby object like building or anywhere he can be thrown. So like the injuries caused by these shock wave uh, to the human person, so it will cause the movement of all these shock waves through the body. So the shock waves will move from the external surface of the body to the internal organs, then it will pass on from the body. So that is the scenario. And whenever these shock waves are passing from the body, then it causes the damage to the organs inside present, especially the organs which are hollow in nature, like the lungs or intestines or the ear tympanum. So the organs where the air or kind of hollow kind of organs are there, they are more damaged as compared to the solid structures in our body. So that will cause the lacerations of the liver, then the rupture of the tympanic membrane, then the rupture of the intestine, and that kind of the internal injuries you may get in all such kind of the bomb blast injuries. Second type of injury is there, that is because of the these moving parts, whatever these splinters are there, they will move with a very high speed. And whenever these splinters, they will strike to the body, they cause the different types of the injuries. It depends on the what kind of splinter they have used in the that blast. or like if a cylinder is blasting, so it may possible that some of the area or some of the part of the cylinder is striking to any person, then can cause the injury to that person. Especially in cases of the bomb blast injuries, these guys use the different types of the sharp nails and like small pellets, metal pellets and all that. So these flying objects, they strike over the body and they penetrate inside the body. So it depends on the force that how much force these splinters are striking over that part of the body. But usually these splinters, they will cause the different types of the abrasion, contusion, laceration, sometimes the penetrating wound, or sometimes they are going deeper inside the body into the cavities also. So that kind of the things may occur in such kind of the blast injuries. The another thing here, you can see there are the flames generated. Large amount of the fire or flames are generated that can cause the catching of the fire in the nearby area, and that can create the fire or the flames. So if any person is there in that area, he may get the burns. So burns injuries that may also be present over the body. And with that, the fourth type of the injury, that is due to the throwing of this person. So like this person has been thrown to a wall, so he will, whenever he will be in the air and will strike over the ground due to falling off, then he may get some of the fractures, head injuries, or different type of the injuries similar to the fall from height. So these are the four basic mechanism you can see here. In all these manner, a person may get injuries of different types due to explosion. So let's see one by one. These are the blasted waves. I have already told you, these are the initial high pressure wave from an explosion that can cause primary injuries affecting air-filled organs like the lungs, ears, and gastrointestinal tract. The second one is the flying objects or debris propelled by the explosion that may lead to lacerations, cuts, penetration, or any kind of the blunt trauma that may happen over this. Then the body displacement, when the person has been thrown away by the blast wave, or sometimes when the blast is occurring inside the building may itself collapse. That can lead to the different types of the head injuries, and the bricks and all the material, the heavy material may fall from the ceiling or from the wall over that person. So that kind of the different scenario may be there. And here you can see that there are the flames and smoke. So that can also lead to the different types of the burns over the different parts of the body, as well as sometimes there is large amount of the smoke is produced because of the burning of the material in that area, and that can cause the asphyxia due to inhalation of the smoke, or you can say due to inhalation of the irrespirable gases. So these are the different types of the injuries you can see over the dead body, or whenever you are interacting with the patient in emergency in a case of blast injuries or explosive injuries. So now I would like to share some of the case series which we came across in our 𝐬𝐬𝐬𝐻, but in the especially during the last Diwali season. So it was a period of somewhere around November in last year, and this first patient who was a 13-year-old male came to the emergency department of the 𝐬𝐬𝐻, and he sustained the injuries while attempting to ignite and throw a firecracker. So this is a common tendency of the people, like they are means igniting the firecracker in their hand, then they are throwing it. So sometimes mishappening occurs and the cracker blasts in their hand. So this was the similar kind of the case where a small boy of 13 years who got the injury over the hand due to the blast of the cracker. So vital signs were within the normal limit at the time of the admission in emergency, and routine blood work was done. All parameters were within normal limit, and X-ray was showing almost complete amputation of the right hand at the level of the wrist. So this was the scenario in that particular case. And when we examined locally this patient in emergency, then there were some of the abrasions, contusions, and laceration. And the most important part, there was a traumatic amputation of the right hand at the level of the carpal bones, or you can say broadly at the level of the wrist joint. With that, multiple contused abrasions of nearby area over the front of chest, face, and over the forearm, that was also there in this case. So here, this is the case. Here you can see the child was post-operative pictures we are having because the patient was immediately taken into the emergency OT. So at that time we could not capture the pictures. So after that, when the amputation was done, uh, you can see some of the pictures. In first picture, you can see these are the typical type of injuries on this front of leg. Also you can see the typical injuries which include the abrasion, contusion, as well as some in some areas there may be laceration also. So in cases of the bomb blast injuries, when these splinters they are striking with the body surface with a quite high force, then it causes a triad, classical triad of injury, which includes the abrasion, contusion, and laceration simultaneously in one injury. So this was the first case, and this management was done for this patient, and the debridement and wound wash and disarticulation from the wrist joint was done, amputation was done, and radial ulnar arteries were ligated, debridement was done, removal of carpal bones which were not of use at that time, and then the wound closure and aseptic dressings were done. So this was the case we came across during the last Diwali season, and in similar, this is another case in which a patient of again a young male of 19 years on 31st October, so just before 1 or 2 days before the Diwali last year, the patient sustained the burns while assisting an individual in handling the inflammable materials, which was collected from the firecracker and a yellow powder that was gandak. So, you know, the gandak potash that is used commonly for causing the explosion in firecrackers. So that boy was trying to mix the different types of the inflammable materials which was taken out from the different firecrackers, and he was trying to mix all these inflammable powders in a wall using a wooden stick, and suddenly a blast occurs and the person got injured. So this was the scenario, and during the admission of hospital, the vital signs you can see on the admission, investigations were done, and during the local examination we found that the burn area, because here you can see there was no big kind of the blast was there, so the person got only the superficial injuries because of the burning of this powder. So actually there was not much of the blast, but burning because of the inflammable powder was there over the body. So this person got burns over the left side of the face, left hand, left foot, and yes, his left eye was also involved. So he got the burns over the cornea, and later on the person was having the blindness because of the corneal involvement. So this was the scenario, and here you can see the some of the pictures. In that you can see the yellowish substance. This is the gandak stain over the left side of the face. You can see the injuries, the abrasion, burning effect, and involvement of the left eye. You can see there is a swelling, eye is closed, even the burning of the eyebrows is present with the involvement of the almost complete left side of the face. And here you can see the similar kind of the injuries over the uh, his hand on this little portion of the wrist as well as the front part. So this was the external examination of this patient who was trying to mix the inflammable substance. Management was done. I'm not going in detail regarding the same. And these were the different steps of the management. But here you can see the injuries are superficial. They are not going deep as it was in previous case. Because here the blast effect is or the shock waves were not generated. Yeah, so this was the case third, and on the Diwali on 1st November, the accident occurred when the patient, as at his own home, he was trying to uh, manipulate a gas cylinder. So he was trying to put on the gas and he was changing the gas cylinder, but due to some defect, the gas was leaking. And because it was a time of Diwali, so some firecrackers which were the children were uh, blasting outside, the fire from that nearby firecrackers that leads to the set of a fire in that case. So this was a combination of cylinder was blast injury as well as the firecrackers. So that was a rare scenario, but that was the thing in this case. And here you can see the how the whole hand of this person was completely blown off because of the blast of cylinder. So almost complete amputation was there. This is a picture which was taken during the admission in the emergency, and the whole hand was completely almost there was a near total amputation due to blast injury. So here you can see the burning is less, but the effect over the left hand is basically due to blast injuries. Right. So here you can now you can understand the difference between the uh, different types of explosion where the blast is more or where the injuries kind of due to burns are more. So this was the X-ray of the same patient. Here you can see the bones are shattered off in his hand, and this person was finally went for the assessment whether his hand tissues are viable or not. So a reconstructive surgery can be planned. But here you can see in the arteriogram that the blood supply to the hand is almost nil. So that's why the doctor decided that there is no blood supply in the distal part. So they finally decided to amputate the hand from the wrist area. So such kind of the cases are coming to the hospital and the now what medical legal significances are there in such kind of the cases when we are encountered in emergency, especially related to the uh, various type of explosion. So as a forensic person, we should try to identify the specific injury types whether it is a explosive injury or not. Because sometimes, the people try to hide if some person is preparing kind of bomb or and all that. So if it is accidentally blasting at that time, so they try to hide that, oh no, no, I was not involved in that. So we should try to identify whether it is a explosive injury or not. And yes, if we are sure that yes, it is a explosive injury, then what type of explosive substance they have used? That is again an important part of the investigation for the police and local administration. So whether it was the firecracker or some kind of cylinder blast or some kind of dangerous material like which are commonly used in the preparation of the bombs and all that. So these are the another other parts of the investigation that has to be taken care, and we can help out the investigative agencies by giving them sample from all these areas. So whenever such kind of the cases are coming to us, we should always preserve a swab from that area, and it should be sent to the forensic science laboratory to confirm what kind of explosive substance was used in this particular case. So that will help to the investigate agencies to investigate the different areas of that incidents. So now I'm moving towards, can we have some questions over this blast injury, if anyone is having?
Good evening, sir. Am I audible?
Yeah.
Sir, can you please explain the meaning of febrile?
Afebrile. Afebrile means
Yes.
patient was not having fever at that time. So this is terminology where we use that during the examination, whenever we are examining the patient in emergency, then we have to note down the vitals, blood pressure, pulse, then respiratory rate and temperature. So when we are measuring the temperature, we can say that the temperature was within normal limit and the patient was not having any kind of the fever, means afebrile.
Thank you, sir.
Anything else?
No, sir.
Okay. So I think now we can move on to our next part of this session, that is the regional injuries. And whenever we are talking about the regional injuries, that the most common injuries in any of the accident, in any of the fall from height, or even in cases of the assault is the head. This is the primary area. And whenever there is a head injury, it may lead to death of that person because there is a very less scope uh, for the intervention inside the brain. So that's why this area is very, very important. And regional injuries, yes. So regional injury, it generally refers to the damage or harm is sustained to any specific areas or region of the body. So regional injury, whenever we use this terminology, means we are talking about the injuries sustained to a particular region of the body, like head injury, chest injury, abdominal injury. Okay. So these are the regional injuries. These injuries, they can occur, in different types from the fall from height, in different type of the sports activities, especially in road accidents. So in road accidents, we all know the people who are going on the two-wheeler, if they are not having the helmet or wearing the helmet, they will fall either on the left side or on the right side, and they will get the injury over the head. So that is one of the common scenario of the head injury in the road accident. And especially in four-wheeler accidents also, when the head strikes to the dashboard, then also it causes the injuries. So whenever the mechanical force is applied on the head, it can cause the injury to the external surface, that is the skin of the head, that is known as scalp, and below that there is a skull, means the bone of the head and face that can be injured. Below that, there is a brain which is covered by the different type of the meninges, dura mater, pia mater, and arachnoid matter. So these are the three basics coverings of the brain. And below that there is a brain itself. So that can be injured and it depend on the different type of the force, how much amount of the force is applied, what was the direction, and in what manner it has been applied. So in that way, there can be different types of the injury over the head. It may be a kind of abrasion, it may be a kind of contusion, sometimes the laceration, or like if bullet is coming or if any sharp weapon is penetrating into the hand, into the head, then it can cause the puncture wounds. So here you can see the injury over the scalp. In this picture, you can see this is the skull bone. This scalp has been reflected during the autopsy on the back side. So if you have gone through the autopsy, or if you have attended the autopsy, then you can think that we remove the scalp by just putting a coronal incision. We reflect the front part of the scalp in front area, back part of the scalp in the back area. So here you can see the front part of this scalp, which is completely contused. You can see this blackening. So this one is the normal scalp tissue, and here you can see the contusion. Means there was a trauma. It was a case of road accident in which there was a head injury, and the whole scalp tissue is showing the contusion. And below that, here you can see there is a hematoma adherent to the bone, and here you can see some of the linear fractures of the skull. So in this manner, we can get the injuries over the scalp, and whenever we are examining the scalp from external side, you can feel a swelling. So these type of contusion, they will be felt only in the form of a swelling over the head. Sometimes due to tearing of the scalp, there may be a laceration that can be seen externally. So this is another case where you can see again the scalp is reflected on the posterior side, but on front side you can see on the right side there is a large blackening of this scalp tissue. That is again a large contusion of scalp tissue. Here you can see the linear fracture of the skull bone, which is going in this direction. And this one is a hematoma, antemortem hematoma adherent to the skull bone and involving the whole of the scalp. So this kind of injuries may be present over the scalp. And now when we reflect the scalp, then we will find out the skull. So if the skull is involved in the trauma, then the trauma can cause various type of the fractures. So here are the common list of the fracture. This one is the most common one, is the linear fracture, which is also known as fissured fracture. Then if there are multiple linear fractures mixed with each other, then it is known as comminuted fracture. With that, if there is a force is greater, then the whole of the skull is shattered into the pieces that can cause the fracture or crushing of the skull. So that can be seen in cases where the head is coming under the tire of any heavy vehicle like truck or bus or a car. Then the complete crushing of the head can be seen. One is the hinge fracture, in which the anterior half of the skull is divided completely from the posterior half. So fracture line passing from the left side of the base of skull to the right side of the base skull, dividing the skull completely into the anterior half and posterior half. So it plays like a hinge. That's why it is known as hinge fracture. Again, next, fifth one is gutter fracture, in which whenever any bullet is or any solid and force with force, any object is moving and striking over the head, then it causes a gutter formation over the outer surface of the skull. So that causes it forms a superficial gutter that is known as the gutter fracture. Pond fracture, that is classically seen in cases of the children, where the bones of the skull, they are quite flexy, and whenever the pressure or the force, blunt force is applied, then only sometimes the internal or sometimes the external surface of the skull is fractured only. So that is known as pond fracture. Seventh one is the diastatic fracture, in which whatever the sutures are there in the skull, they get separated out due to blunt force at that area. So there is a fracture as well as separation of the suture. So that's one is known as the diastatic fracture. In case of perforating fracture, any penetrating object that is going inside the skull cavity, it may be a bullet, it can be a sharp, any weapon like axe, heavy and sharp weapon, or like any kind of arrow or that kind of penetrating thing can be there. Cut fracture, obviously, it is caused by the heavy and sharp weapon that can cause the cutting or sharp impact over the head that can lead to the cut fracture of the skull. So these are the different type of the skull fractures, and some more terminologies are also given in various books by the different authors. So here I am sharing some of the photographs which I have clicked during the autopsy. Here is the classical presentation of the linear fracture. You can see the classical fracture. Here is the linear fracture. Again, this line is the linear fracture. This one is again one more linear fracture is there. So this is actually the commonest type of linear fracture. And yes, I have taken these pictures in autopsy, but if only such kind of the small linear fracture is there, there may not be any significant change inside the brain. So brain may not be having the any impact kind of intracranial hemorrhage and all that. So in such kind of the cases, patient may get discharged even after the some time, because if the brain is not affected. But here you can see the whole skull has been separated completely, and this person, the dead body, came to us with a history of road accident. This one is the another picture of the linear fracture. Here you can see the linear fracture was going through the coronal suture also. So here you can see the fracture is there as well as the suture has been separated out. So this is the coronal suture. This is going here to here. And the fracture line is going here, 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 and this side. This is again a sagittal suture. So this type of sutures are linear as well as diastatic suture, where the diastasis of the suture is there and it has been separated out. This is another case where you can see there is a classical linear fracture which is causing the separation of the suture. Again, you can see the coronal suture has been separated out completely in this case. Here you can see the comminuted fracture, multiple linear fracture. You can see even the brain inside, you can see from this fracture gap. So the impact was very high, and all the bones are having the large widening space with fractures in the different bones of the skull. So that is again a comminuted variety of the fracture. Here you can see the depressed fracture. So whenever the force is there as well as the weapon is heavy, so it will strike on that particular part of the bone of the head and it will be depressed. It will go inside. Some of the bone pieces here you can see they have gone inside, and this is known as the depressed as well as comminuted fracture, because the multiple linear lines are there with a depression of the fracture bones. This is again another photograph of the depressed fracture. Here you can see the classical this type of force. It may be a kind of a weapon, it may be a kind of back of any axe or hammer kind of a thing may be there. So which when it was striked, this portion of the bone of the skull has gone inside in the form of a depression. So this is a photograph of hinge fracture. Here you can see this is the base of the skull where the brain has been completely removed, and after you can see the fracture line is coming from the left side to passing through the medial side and going to the right side. So completely dividing the base of the skull into the anterior half and posterior half. That's why it is known as hinge fracture. Again, this is a crush fracture. I have already told you that sometimes the force is like the head is coming under the tire of a heavy vehicle like truck or bus or that kind of. So the whole brain is crushed out. The skull is having the crush fracture. Sometimes the brain coming out from the ear or from the defect of the head. And that is another case of the crush fracture. So these are the different types of the fractures. Now I want to highlight about the coup and counter coup injuries. So coup injury is the injury on the same side of the site of impact. So suppose the impact strike over the left side, the injury in the brain will be on the left side. That is the coup injury. But in case of counter coup injury, it occurs at a site opposite to the point of impact. So impact is on the left side, but the brain is moving inside the skull, and it will strike over the right side inner part of the skull. And on that area of the right side, there will be a contusion over the brain. So external injury over the left side, that will be present over the scalp, but there is no external injury on the right side. But brain inside the cavity, that will have the injury over the right side because it is moving. So force is applying over the left side. Brain is moving and it is striking over the opposite side of the skull. So that will cause the injury over the right side. That is known as the counter coup. Coup means on the same side. Counter coup means it is opposite to the impact. It may occur anywhere. It may occur in liver also. It may occur in lungs also. It may occur in heart also. But here we are talking about the head. So in this photograph, you can see easily the head is striking in front area. So whenever the head is striking, the person is getting injury over the front part. This one is the coup injury. Impact is here and injury is on the same direction. But what happens in such scenario? Head will strike here, the brain move will here, it will get injury here, but again it will come back in this area and it will strike here also. So in that case, here you can see the counter coup injuries. So brain is having the impact over, head is having the impact over here. Brain moving in this direction will get injury over this area. That is counter coup. So primary impact, coup injury. Secondary impact inside the brain because of the movement, that is counter coup. Now I'm talking about the intracranial hemorrhage. So we discussed that what type of skull fractures can be there. Then the different type of the hemorrhage which can occur inside the brain, and that can only be seen in a live patient by doing the CT examination. So intracranial hemorrhages, they are basically a serious medical condition involving the bleeding within the skull and between the different membranes of the head. It may commonly occur due to trauma, but yes, it can also occur due to rupture of the blood vessels when the person is having the high blood pressure, or due to sometimes it may occur due to rupture of any aneurysm or any congenital anomaly inside the vessels of brain. These are basically four types. One is epidural, means it is outside the dura. Subdural, which is below the dura and outside the subarachnoid membrane. Subarachnoid hemorrhage, that is below the subarachnoid layer and outer side of the brain surface. Intracerebral, that is the fourth one, which will occur inside the brain tissue. So these are the four basic type of the intracranial hemorrhages. So here we can see some of the pictures. Here you can see this one is the dura. You can see the arteries. These are the branches of middle meningeal artery. And outer this dura, there was a hemorrhage due to impact on this side. So this one is extradural because this one is dura and hemorrhage is outside the dura. So this hemorrhage is classically present between the dura mater and the skull bone. So it will be in a shape of biconvex type of. SDS, subdural hemorrhage, here you can see just below, after removal of the dura, if we will remove this thick layer of the dura, then you have to see this type of the injury, brain. So in another case, you can see the different, this blood is there. It is also coming over this surface, that is subdural hemorrhage. Now, subarachnoid hemorrhage. Here you can see there is a membrane. You can see this membrane, and below the membrane there are the hemorrhages. Here hemorrhage is there. The vessel is showing the deep congestion with many of the areas are showing the hemorrhages. So this one is the hemorrhage. All these areas are having the subarachnoid hemorrhage. Here you can see the this membrane has been torn and the actual brain is visible. So this is the classical picture of the subarachnoid hemorrhage. Another picture of the same subarachnoid hemorrhage. This one is the fill subarachnoid membrane, and you can see the shining subarachnoid hemorrhage just below that. Another picture of subarachnoid hemorrhage. Sorry, is a bit blurred. This is another picture of subarachnoid hemorrhage. Here you can see the shining portion due to meninges membrane, and below this membrane there is a hemorrhage, that is subarachnoid hemorrhage. And if the brain is getting injured, then it may have the contusion, laceration, and different type of the injuries. So here you can see the left lower lobe base, frontal lobe, that is having the contusion. Some portion of the right frontal lobe that is also having the contusion. Here temporal lobe contusion, lateral part of temporal lobe. These are the contusions. So these are the contusions over the brain. In another picture, you can see there was contusion as well as laceration. So the brain tissue in this area got the higher impact, and the whole brain got lacerated in this area. This is another picture of the contusion. Here you can see the small contusions are here. These are the contusions. All these are the contusions. There is contusion. Here is the contusion, and this one is the collection of the blood. So these are the different pictures. Here again you can see the different case where you can see the different type of small contusions in this area with laceration and sloughing of brain you can see in this area. So what are the signs of head injury? So suppose you are getting a case in emergency. You are working in a hospital and a case of road accident or fall from height is coming. Patient is unconscious. How you will get to know that this patient is having internal head injury? Can anybody tell what are the signs of head injury? Okay. So here are the signs of head injury. Signs of head injury, they can vary depending upon the severity. So first thing, the patient will lose the consciousness. He may come to you in semi-conscious state or with a complete unconscious state. There may be bleeding from the nose, ear, mouth, and all that because of the fracture of the bones in that area, and the blood is leaking from the brain to the external orifices like the nose and ear. And I have already told you, like, there is a swelling of the scalp over the head that can be felt if it is there inside the head. Obviously, the patient will have the severe headache, and he will be drowsy, disoriented, and because of the increased pressure inside the brain, there may be a nausea and vomiting. The patient will be confused, disoriented, drowsiness. All these things will be present. There may be changes in vision, blurring of the vision can be there, memory issues with pupils dilated, sometimes the seizures. The patient may present with the convulsion. Loss of coordination of the muscles, weakness, and irritability. Shouting and unconscious, he will not be able to reply, he may not be able to breathe properly. These are the all signs of head injury. And obviously, if you are having a case and suspecting the signs of head injury, you should immediately give the proper treatment. Otherwise, you may lose your patient. And the best thing is to have a CT just to have an assessment of the internal injuries. So you have to go for the CT scan where you can see the. And guys, this is one of the most common cause of death. That is the head injury in cases of the road accident. So this is the common scenario in India, and lots of the road accidents with two-wheelers and four-wheelers are there. And whenever you will study, so this was my topic of thesis in 2002 to 2003. I studied in road traffic accident, and I found that in all autopsy cases, almost 60% of the cases of road accident, they died because of head injury only. So that was from my side. Thank you all for patient hearing. Can we have some questions?
Thank you so much, sir. Participant, if you have any question, just write in a chat box or also unmute yourself and ask to him.
So do we have some questions?
I think, sir, there is no question from a student side.
Okay.
Student, we are waiting. If you have any question, just write in the chat box or also mute yourself and ask, sir, if you have any questions.
Yeah, or they can ask later also if they
Yeah.
want. They can message me or kind of. So I think there is no question from your side,
Yes,
and
sir,
I
thank
hope
you.
I did justice with this topic.
Thank you so much, sir, for this wonderful session. Sir, with your permission, can we end today's session, sir?
Yeah, please. Uh,
Thank you so much, sir. Good evening, everyone. Good evening, sir.
Thank you.
Thank you so much, sir.